How are you sleeping? Or I should ask, how are you breathing? You know what? If you snore, you could have both trouble breathing and sleeping, and it could be very dangerous to your health. Joining us right now is Dr. Gary Huang, an ear, nose, and throat specialist at Summa Health. He's joining us right now. Doctor, it's great to have you here. Let's talk about this. We're calling it sleep apnea. So many people talk about it, but really, what exactly is it?
Thanks for having me on, Joe. So obstructive sleep apnea is the most common sleep disorder actually in this entire country. Essentially, it's where the upper part of your airway collapses a bit and decreases the airflow to your lungs. This results in what we call apneas, which is where your breathing slows or actually entirely stops and causes that drop in oxygen.
So many family members know some of us snore, but how do we know if we actually have sleep apnea?
So a lot of people actually have minimal symptoms, which worsen over time, which kind of speaks to how underdiagnosed this problem is. The risk factors include things like you mentioned, family history. There's actually a correlation there with immediate family members have sleep apnea that you may be at risk as well. Other risk factors would include obesity, age, smoking. And then in terms of common symptoms that people report, they often include things like snoring, which everyone's kind of familiar with. And then the previously mentioned pauses in breathing, which a bed partner may tell you about. Some people complain that they wake up gasping or choking. And then a general kind of poor sleep quality where they feel kind of tired during the day, even if they got a full 8 hours of sleep. There are some other symptoms that are a little less specific, things like weight gain, decreased sex drive, reflux, which are not specific, but also kind of play a role within sleep apnea.
Doctor, are there moments during the evening or the nighttime when you're sleeping or whenever you're sleeping that you actually do stop breathing completely?
Yes, that actual apnea is where sometimes the entire airflow cuts
Wow.
off. And, it's obviously causes issues long term. It can cause some heart and lung issues
Mm.
if
And how
untreated.
important is it to see someone like yourself for treatment?
So sleep apnea, I think, is most dangerous because a lot of it's kind of, we think about it like diabetes or high blood pressure, in that a lot of the effects take a long time to take effect. And when it manifests, it can be as something a little more devastating, kind of the same way that high blood pressure may not cause you issues until you have a stroke or something like that.
Hmm.
Sleep apnea takes time to build up. It can cause heart and lung disease. Due to poor sleep, there's actually an 8 times higher risk of a car accident. There's
Oh my
also
goodness.
things like obesity and diabetes.
Right.
And more practical level, people who are persistently tired often perform worse at work or at school, and they have kind of worse mental cognition in general.
Let's talk about what Summa Health is doing for people with sleep apnea.
So Summa Health is starting a comprehensive sleep medicine program. So we're planning to try to treat OSA kind of from start to finish. OSA is not a problem that's isolated to one organ system or one doctor. In fact, my part as an ear, nose, and throat doctor is actually pretty just a small piece of the puzzle. We have sleep medicine doctors and sleep neurologists, so which are often the first point of contact to help you diagnose your actual issue. Is it sleep apnea, or do you have another sleep-related disorder? And they'll get you on the proper non-invasive therapies such as CPAP or dental appliances. We have adjuncts such as a very good bariatric surgery and weight loss program here, given that obesity plays a large part in obstructive sleep apnea. We as ear, nose, and throat doctors tend to be involved when people are not able to tolerate their CPAP, or the severity of their CPAP or of their OSA is so significant that they need surgical intervention, which could involve anything from opening up the nasal airways so you can tolerate the CPAP better, so it doesn't feel like you're suffocating. And then there's surgeries on the tonsils and palate. And we are actually very excited as we're starting a hypoglossal nerve stimulator program here, which is a newer implant surgery, which essentially protrudes your tongue when you're sleeping and kind of opens up multiple levels. It's been shown to be very helpful and effective in people with severe sleep apnea.
Well, for more information or to schedule an appointment with a Summa Health ENT specialist, here's the phone number. It's 330-375-6917. That's 330-375-6917. Doctor, thank you so much for your insight and all that you do.
Thank you for having me. I really appreciate it.
This segment of It's About You was sponsored by Summa Health.